Good morning. A new study by the Manitoba Centre for Health Policy has found that Manitobans living in social housing have higher levels of physical and mental health problems. Lead researcher Mark Smith joins us now. Good morning. Thanks for being here.
Good morning, Courtney. Thanks very much.
So this is a really exciting study. It's the first of its kind in Canada.
Correct. It is the first time we've been able to take government data on housing and link it up to other government services data.
So who all was studied here?
We looked at people in housing, about 31,000 Manitobans in Manitoba housing buildings over a 5 to 10 year period.
Wow.
That was basically.
And some good results, some not so good, but it starts young. We saw even with youth there are some alarming results. Yes,
we looked at the Family First screen, which is right at birth. How prepared the family is to look after the child. We look at the EDI scores, a number of indicators along the way, breastfeeding initiation, and overall what we found is that things generally are 2 to 3 times worse in social housing than as compared to all other Manitobans.
Yikes.
But there were some exceptions as well.
And that would include high school graduation rates.
High school graduation was very interesting actually. We found some good news there in that in better off neighborhoods, kids are graduating at a very high rate, similar to the rest of Manitoba, but in lower off neighborhoods that are less well off, graduation rates were very poor.
Interesting.
So there was a gradient across Winnipeg community areas depending upon income level, and the higher income levels had students in social housing graduating at a higher frequency.
Also some alarming research about teen pregnancy.
The teen pregnancy rate is not encouraging, that's for sure. It was much higher in social housing, less of a gradient than what we saw with the high school completion though. So a little more challenging, I guess, to interpret, but overall not a good outcome generally speaking.
Okay, and then when we move on towards mortality rates and suicide rates, also there we see an increase.
Generally, health status measures are 2 to 3 times worse in social housing. But when we look at things like healthcare utilization, so the percentage of people who are getting complete physicals, how often they're being seen by the same physician, or even pap smear rates, we find there's hardly any difference at all between people in social housing and all other Manitobans. So it's interesting that the utilization measures we looked at are not that different, but the health outcome measures are, which suggests kind of like the healthcare is not providing all the needs that these people have, right? And I think that's one of the recommendations in the report as well.
So what do we do now? We have this information, it's now in front of us. How do we fix things?
Well, there was a couple of things that we pointed to that could be looked at. There was some good news around 2-year immunization rates and around pap smears that we said maybe there's a template or a model there that could be taken and applied to other situations. There were a few things that were still worse off in social housing after controlling for poverty. Mammography screening was one, high school completion was another. And so we said maybe look at those and see what the challenges are around improving those outcomes. And I think the third one is we recognize that people in social housing are faced with many challenges, not just health, not just income, but also education, social services, justice, and so on. And so if there's a better way to package the delivery of services to that community, we know where they are, we know how to reach them, can we provide a more intensive sort of rehabilitation, let's say, of the challenges they're facing and try and help them move forward in life? Well, a really interesting report with lots of data in it and a great place to start to move forward from here. Absolutely. And you can find the full report up. We have it on breakfasttelevision.ca. Thank you so much, Mark. Thank you. Thanks. We're taking a quick break here in BT. Stay with us.